Hey everyone, welcome to the last week for the course. We are going to cover zoonotic diseases this week. You're going to find that most of the things that are in here for bacteria that we pretty much have discussed at some point, whether it was in this course or in Micro 1. So hopefully some of this is review or just really good refresher. But let's just get started into this. So I'm just going to switch this to slideshow mode. There we go. All right. All right, so first we're going to start with those infections that are transmitted by scratches, bites, or other contact with animals. So Pasteurella multocida. This is one that anytime you think about Pasteurella multocida, you should always associate it with dog bites, cat scratches, that kind of thing. So it's coming out of the oral cavities of most dogs and cats, and that's pretty much the only times that we see it in the lab is when somebody comes in and they've had a dog bite them or a cat bite them or something like that. So we do usually highly see this linked with dogs and cats. So anytime you get a case study question or something on that, and it's referencing a dog or cat in that situation, you should have Pasteurella in the back of your mind as one of the possibilities. It is a gram-negative rod. It's oxidase positive. It does not grow on McConkey agar, so it is a little pickier. Non-hemolytic, and it has this like mushroom or musty smell to it. Still very much susceptible to penicillin. And again, the way that you get it is bites or scratches from those dogs or cats. It could also be that you have an open abrasion on your hand and say your dog or cat licks you. It could go into that abrasion then as well. So otherwise, pretty much don't see it outside of a scratch or a bite from an animal. So again, always link it with dogs and cats. Erysipelothryx rhusiopathiae. This is a gram-positive rod, non-spore-forming gram-positive rod. It is catalase negative, very much H2S positive. This is the one that I always say it is the only gram-pos rod that is H2S positive. So that's a big characteristic for it. This is also still very much susceptible to penicillin. And as far as the zoonotic part goes, it's carried by animals. It's not really part of their normal flora, but they can carry it. And if you were to handle those animals in any manner or take in contaminated food or water coming from the animals, then it will result in a skin infection called erysipelas. So that's the infection you get is these skin ulcers that they name erysipelas for the bacteria Erysipelothryx rhusiopathiae. Pigs are a big carrier of this gram-pos rod. Other animals are too, but I know pigs are one that do definitely carry this. All right, so the manifestation of that skin ulcer, you'll get an infection of like an abrasion, especially if you've been like handling an animal and you already have like a wound there, it can infect it again. And it's gonna basically, usually it'll heal without treatment, it says here on this first part, but it can go into a more further cutaneous form, more skin ulcery, like kind of lesioning out, or it will even go into a systemic form. Of course, those would definitely require treatment. So there's kind of what it can look like. And then on the little piggies. All right, capnocytophagia canemorsis, as the second name should imply, you're going to already think dogs with the canine part. But a capnocytophagia is a gram-negative rod. It's a fastidious one, so it's not going to grow on McConkey agar. And the word capno, as part of the first name there, means CO2. This needs additional CO2 levels in order to want to grow. So it usually requires around 5% CO2 levels. So the capno means CO2. So it can be anything from a little bit of an infection to all over septicemia that can be very fatal. So again, it's found in dog and cat oral flora. So usually people that pick this up and get it will be already immunosuppressed. So their immune system isn't the greatest anyway when they get this. And that's why it can maybe sometimes go to that fulminant septicemias, because their immune system isn't doing the job it's supposed to be because they have another underlying disease. So again, Pasteurella multocida and capnocytophagia both link with dogs and cats. Then we have a few bacteria that cause what we call cat scratch disease, not cat scratch fever, for those of you that might know the song, but cat scratch disease. So Bartonellas are one group that definitely link to this. We have Clarigiae henselae, which is the most common. Usually they're passed by a vector, so cat fleas, ear mites, ticks, and then that can pass the Bartonella organism. They are gram-negative rods, oxidase negative, but they are fastidious, so they will not grow in Grumman-Conchiager. And you usually will see a lesion at that scratch or bite site, and then you get the typical infectious symptoms. All right, so those are all those ones. Now we'll move into zoonotic infections transmitted by direct contact or inhaling. Of course, when you think inhaling, you should think anthrax. We do consider this a zoonotic disease as well because of the whole sheep thing with coming out of the soil and into the sheep wool, that kind of thing. That whole nickname wool sorters disease comes into mind. So Bacillus anthracis is found in the soil, and when animals graze in that grass, they can pick up the spores and have them, like especially in the sheep, embedded in the wool. And then when you handle that animal or shear the wool, you can pick up anthrax. So there are vaccines available for both cattle, actually, and humans that are more high-risk occupations for handling animals that graze, but we definitely see it for that part. So we talked about anthrax for bioterrorism, but it is also a zoonotic disease. As far as, I don't have a slide on it separately. We've reviewed this in class, but just real quick again, it is a gram-positive rod, spore-forming. It is catalase positive, non-motile, non-hemolytic, and then it has those medusa head colonies, or you can call them comma projection colonies when they grow. So those are kind of some quick characteristics, and it is still susceptible to penicillin. So you should know those characteristics already, but keep them in mind. All right, tularemia caused by Francisella tularensis, a gram-neg rod, oxidase negative. Tularemia is definitely passed by infected animals, especially rodents, prairie dogs, that kind of stuff we've always discussed. So anything having to do with that infected animal, maybe if you handled it, you got a vector, like a tick from the animal onto you that bit you and transmitted it, the animal itself bit you, whatever it might be. But it is definitely passed by animals. Rabbits are always a big one associated with this, but yes, definitely rodents and stuff as well. So tularemia will cause what they call acute granulomatous disease with rapid onset and flu-like symptoms. It is definitely one that we've discussed with bioterrorism. So it can cause kind of these ulcers, lesions on the different organs within you, and it can have a couple different forms. You have pneumonic, so if you were to inhale this, it could be in the lungs, or you have the typhoidal, which also does involve vomiting, diarrhea, pneumonia, and a high fatality rate. So that's why they love it for bioterrorism. But because it is passed by animals, it is a zoonotic infection. Brucellosis, another one that we've discussed in the bioterrorism chapter, but again, it is zoonotic because there are 4 species that we've linked to different animal hosts. Overall, Brucella is gram-negative coccobacilli, oxidase positive. Brucella abortus is from cattle. Brucella melitensis is sheep or goats. Brucella sui is pigs, and Brucella canis, of course, is dogs. And then again, as far as transmission goes, it could be handling one of those contaminated animals. If you had a break in your skin and it got in there, ingesting, say, contaminated food products like unpasteurized milk coming from a cow that has it, or it could be aerosolized in the lab. That's why they require a safety level of 3 at least to work with this. So again, it's going to cause the similar symptoms: chills, fever, sweating, weakness, fatigue with a lot of things, and then it kind of disseminates throughout the body, causes different abscesses, things like that. So very much why they use it in bioterrorism, it can disseminate throughout. All right, Leptospira. We haven't talked about this guy since Micro 1 in the spirochete chapter. So again, as a reminder, this is a spirochete that has hooked ends and a corkscrew-like motility. Leptospira interrogans is the main pathogen that we are concerned about. This is that one that comes from contact with either the animal or through the urine or blood of the animal. A lot of times a lot of cases are connected with water. So if you're canoeing or something like that, and there's urine or blood of the animal in the water, you can get it that way, and that is seen. So the animals itself that tend to harbor this are rodents and domestic animals. So it will rapidly invade through the body, so it enters many different organ systems, and then it causes disease within each organ system. So if it's in the CNS, it's more of a meningitis. It can go on and cause actual liver, kidney failure, and so on. A form of that infection is called Wales disease when it gets to be that severe. And there it is again what the spirochete looks like, with each end curling in to be the hooked ends. And there they are again. They're kind of, no, they're not cute. All right, and then infections transmitted by arthropod vectors. So, of course, we have Yersinia pestis, which leads to either, you can call it the Black Death or the plague. So it is passed by fleas off of animals that are contaminated. Again, this is highly linked with prairie dogs. So this one we still see in the southwest part of the U.S., so here in Arizona, we do still see it. So again, you can have bubonic or pneumonic plague. It just depends on how it's entering into the body. So buboes will form in the lymph nodes. In pneumonic, of course, it's involving the lungs. And pneumonic, again, was more of the one that goes with bioterrorism. So there, I know that's hard to read. I didn't like how that copied, but you can kind of see it. So it'll talk about entry and exit points and where it goes in each different form of the bubonic or pneumonic plague. So as far as Yersinia pestis, again, it's a Gram-Neg rod. This is the one that has that unique safety pin appearance on gram staining because it does a bipolar stain look to it. On agar plate, it is non-hemolytic, said to have this fried egg appearance. If you grow it on McConkey, it's a non-lactose fermenter. It is oxidase negative. Again, it's one of the part of the Enterobacteriaceae group. So it'll be oxidase negative, catalase positive. It's also urease negative. Borrelia burgdorferi is another spirochete. This is what causes Lyme's disease. And of course, Lyme's disease is passed by a tick. So it will also, there's a Borrelia that causes relapsing fever. That would be more Borrelia recurrentis. But mainly Lyme's disease is caused by Borrelia burgdorferi. Typically, we're not culturing this. We're not working this up like normally. We're doing either blood work, looking for antibodies, or to see if you've had antibodies created to Lyme's, or looking at PCR testing is usually that goes for Lyme disease testing. So Lyme disease itself is passed by tick in the Ixodes family. Starts with that erythema migrans, that target rash at the site of where the tick was. Majority of people do have that target rash in some form. About 60 to 70% of people will show that target rash. But there is like 30% that don't. So with that target rash, you'll start to have a headache, fever, joint pain. Then it will move into arthritis, possible neurologic stuff, and then chronic arthritis for years. Of course, this is found anywhere where you find ticks a lot of times. So there's where the spirochete looks like. You can tell it's quite a different looking spirochete than the Leptospira spirochete. And there it is again. All right. And there's the target rash. The one on the left shows a nice picture perfect look, but of course not everything is picture perfect. So the one on the right shows you another way that it can look. And again, the other spirochete, Borrelia recurrentis, causes relapsing fever, passed by lice in this case. So the lice, Pediculus humanus, is the one that is passing the organism. So the reason it's called relapsing fever is because it will have like a fever, headache, muscle pain for a few days, or it says 10 days, and it will come hidden, and it will start over again and do it all again for 10 days, become hidden and start over. So you see it's totally relapsing and then coming back, relapsing and coming back. And then other zoonotic infections, we have a few just kind of oddball ones here. Rickettsia rickettsii is Rocky Mountain spotted fever, passed by ticks. Orencia susugumushi is scrub typhus, passed by chiggers. Ehrlichia causes ehrlichiosis, passed by ticks. And anaplasma looks pretty much just like Ehrlichia, passed by ticks as well. So with that Rocky Mountain spotted fever, again caused by Rickettsia rickettsii, passed by ticks, that is basically named because it has a rash involved with it. So you'll get the other symptoms of fever and stuff, but the rash is why they name it Rocky Mountain spotted fever. So they'll see this rash, especially on ankles and wrists. Might go into the hands and feet, but usually not anywhere else. So there you can kind of see it. And then in that typhus group, there is a couple others. Endemic typhus caused by Rickettsia typhi, and epidemic louse-borne caused by Rickettsia, oh my goodness, Prowazekii. I don't test on that one. You can ignore that if you'd like. So as far as the endemic typhus goes, again, there's some fleas here for the vector, and you get it when those fleas bite you. I'm not going to worry about the actual names of the fleas. We're not going to go that far. An epidemic typhus passed by either fleas or lice. It just depends. So we're not going to go too in depth here. And then Ehrlichia, this is one that probably was mentioned at some point for you guys in hematology. It is passed by the tick, but the reason we mention heme is that's kind of where we start to see it show up is in hematology, because you will see the Ehrlichia bacteria as an inclusion inside the neutrophils. Both Ehrlichia and Anaplasma look very similar, and they'll be found inside those neutrophils. And so if you're ever working in a tick-prone area, it's something that you should always be screening for when you're looking at your manual differentials, looking at neutrophils. It's something that if you see an inclusion, you should start kind of keeping in the back of your mind, this is one possibility. So, all right, and that's kind of where it looks like. So you can see there on the right is a neutrophil, and the left is actually being shown in monocytes. And again, Anaplasma passed by ticks looks just like it. You can see, you can't tell them apart. You would have to do like an antibody titer or something like that to know if it's Ehrlichia or Anaplasma, because the inclusions aren't identifiable apart. All right, review question. Preferred animal host of Brucella abortus is, pause it now if you don't want me to answer it, but it is cattle. A culture from an infected dog bite yields a gram-negative bipolar staining bacillus. The organism is oxidase and indole test positive. The most likely identification is, and again, pause, but it would be Pasteurella multocida. When you saw bipolar staining, you might have right away start almost thinking Yersinia pestis. We just talked about that. But again, Yersinia pestis isn't usually from a dog bite, and Yersinia pestis is oxidase and indole negative. So that would separate it out if that would have been a choice. Bacteremia, endocarditis, bacillary angiomatosis, cat scratch disease, and paliosis hepatitis can all be caused by, and this should be Bartonella, I believe Quintana. I even forgot this one now. Don't worry about this. We didn't really cover all the Bartonellas. Maybe it's Bartonella Hensley. I'm going to have to get back to you. I might have to relook that up. But all these listed pretty much cause cat scratch. Aphythia felis. We didn't discuss that because it's not very commonly seen. But the felis for cat, feline, that's also known to cause cat scratch. But it's one of the Bartonellas as the answer to this. It's the paliosis hepatitis that separates it apart. I'm not going to have that on the test, so don't worry about it. I just can't remember if it's Quintana or Hensley, and I'm going to have to double check it. All right, tularemia characterized by glandular, ulceroglandular, oculoglandular, oropharyngeal, systemic, and pneumonic presentation, so it can present in any of those ways, is caused by Francisella, so Francisella tularensis. Preferred animal host of Brucella melitensis, and that would be sheep or goats. Yersinia pestis causes bubonic plague. A gram-negative rod was isolated from a wound infection caused by a bite from a pet cat. The following are seen: oxidase pause, glucose fermenter, catalase pause, negative motility, no growth on McConkey, so it tells you it's picky, even though it's a gram-neg rod. Which of the following is most likely? And that, again, is Pasteurella multocida. So you get down those characteristics right here of Pasteurella multocida. That'll help you. The only catalase negative non-spore-forming bacillus that produces H2S is Erysipelothrax ruseopathiae. So you could add in, it's a gram-positive bacillus. So Erysipelothrax ruseopathiae. Which of the following organisms is still susceptible to penicillin? It's Pasteurella multocida. Actually, Eikenella corridans is still susceptible to penicillin as well. So in this case, there's actually 2 answers, but as far as the PowerPoint that we just went through, it would be Pasteurella. A few of the other ones that we mentioned besides Pasteurella is also Erysipelothryx and Bacillus anthracis were all still susceptible to penicillin. Suspect spore-forming gram-positive bacilli that are non-hemolytic, non-motile, and penicillin susceptible are, and again, Bacillus anthracis. So there's all those characteristics you need to remember for Bacillus anthracis. Fluid from a cutaneous black lesion was submitted for routine bacteriological culture. After 18 hours of incubation at 35 degrees, there was no growth on MacConkey, but 3+ growth on sheep. Colonies were non-hemolytic, ground glass appearance. Each colony had an irregular shape with comma-shaped outgrowths that stood up like beaten egg whites. A gram stain revealed large gram-positive rectangular rods. You shouldn't even need answer choices here to answer this. Again, it's Bacillus anthracis. 26-year-old male was seen for flu-like symptoms with fever, muscle aches, vomiting, eye pain, and severe headache. The symptoms came on very suddenly 3 days ago and have been getting worse. Physical exam showed the eye to be jaundiced and dehydration present. Patient had been out canoeing the week before, but has otherwise been nowhere remarkable. The lab results are as follows, and this is on the next slide here, sorry. So you're going to see a high white count, high seg, so that'll indicate bacterial infection. Sodium, chloride, potassium are all there below. You've got Buncreat, look good. ALT, AST, they're definitely high. LDH is high. Bilirubin is high. Those are all your liver enzyme markers, so all those were high. His test for hepatitis, so that was negative. So they ruled out hepatitis because the liver stuff was high. UA and blood cultures were negative, so it hasn't spread to other organ systems. They did some serology tests. They did a monospot heterophil antibody test to rule out infectious mono, because mono is known to cause liver results to be wacko. And then here's your answer. Leptospira antibody IgM positive. So indicating they do have leptospirosis. The canoeing was a key part of this case study as well. That's where they got it. It was from water, probably contaminated with urine or blood of an animal. All right, so that is the zoonotic disease chapter. If you guys have any questions, please let me know. Otherwise, I look forward to seeing you in class. Thanks.